I think that there really are three core imbalances that we really need to address and look at. The first is mitochondrial dysfunction, because mitochondrial dysfunction, we know viruses are and different infections can be mitotoxic,
Yes.
right? We know
Yes.
that.
Hmm.
And so the fatigue, the poor endurance, the prolonged recovery, those are all symptoms of mitochondrial dysfunction.
Hmm.
Mast cell activation, we know, is a predominant feature in many chronic illnesses, and so we see that with the flushing and the rashes and the heat, and the food intolerances that some people are developing, and then dysautonomia, right? Vagus nerve dysfunction. Vagus nerve dysfunction is a key feature in so many chronic illnesses, from autism to chronic fatigue syndrome to bipolar. I mean, we have all, schizophrenia. There's so many factors that really hold our vagus nerve in a dysfunctional state. The parasympathetic nervous system isn't working. I actually think this is one of the most important pieces that, even in functional medicine, we don't have a lot of tools to really normalize. Um, we can give mitochondrial supplements. I talk about a mitochondrial cocktail, for some families that may be beneficial. We can give supplements to support mast cell activation. We can look at foods that support our mitochondria. We can look at foods that don't promote mast cell activation, low histamine foods and high quercetin foods. But vagus nerve dysfunction and dysautonomia, sure, there are vagus nerve stimulators. And in fact, there's a fascinating study that was put on hold, looking at ICU patients and using auricular vagus nerve stimulation right through the ear to prevent and reduce sepsis and cytokine storm. But much of the vagus nerve work that we need to do is self work, right? It's meditation, it's breath work, diaphragmatic breathing, it's heart math, optimizing our heart rate variability, it's practicing gratitude. And these are things that we need to actively do. But I do think that those, if we can look at while we're sick acutely, whether or not it's severe infection or mild infection, let's support our mitochondria, let's support mast cell activation, let's really work on optimizing our vagus nerve. And then if you do have long haul symptoms, those are the key areas that I really think are important to work on.